Okay, we're here again with Dr. Silvano, a licensed dentist in Sebastopol, California. And he and I work closely together on a number of issues, especially what I call interference fields coming from dental problems. And those of you who have had a good look at this YouTube channel have seen several posts of patients who got instant results, and I mean instant, in the office, instant, addressing a dental problem. And Silvano, I think one of the first ones we saw was that young woman who had a frozen shoulder.
Melanie.
Yeah.
I'll leave it at that. Melanie, yes.
Right.
Very interesting case. She came in with a frozen shoulder, could not lift. Her left arm was her left arm in this case. And I remember you had given her one Procaine followed up with a little ozone just in the general area of where her wisdom tooth would have been, and immediately got relief.
This is a woman who she walked into this office, and she's in her early 30s, with a frozen shoulder after a chiropractic adjustment. And I said to her, something's not right. It can't be. And when I evaluated her, I couldn't find any other disturbances except a problem in a wisdom tooth socket. And I put some Procaine into it, and from a frozen shoulder, she could do jumping jacks in about 15 seconds. Isn't that amazing?
It was amazing.
And what happened when I sent her over to you?
Um,
What'd you find?
I found that in the area of the extraction sites of the lower right and left wisdom tooth, there was some what dentists call cavitations, which is also known as osteonecrosis. In other words, there's dead bone in the area. So I worked with her, and we gave a series of ozone injections in the bone to get that bone to regenerate. Clean it out, get that garbage out of the bone, get that bone to regenerate. She's 85% corrected, but she has another interference field. There's more than one sometimes, and we haven't corrected that up. Her mother, you sent me her mother also, is the story of the one-tooth turnaround life story. Immediate turnaround.
Now you're a dentist, so you concentrated on the tooth. Let me concentrate on her back. She came to me crippled. She could barely walk in the door. And I said, before I start sticking needles in your back, let's check your mouth. And sure enough, it fixed her. Well, it tested positive. She got dramatically better. Now she comes in once in a while for me to do prolozone on her back, but it's rare because she can do a jig. And this is a woman who was crippled, and the crippling was coming from a tooth. Tell the viewer about that.
This is probably, I'm having the chills right now. Her mother comes in, hidden behind Melanie. Hidden. She's very afraid of everything, very afraid of life. She will not go outside. She's agoraphobic. She will not drive. She drinks water all day long. She's got sodium imbalances. Robert picked up that tooth number 12 had a root canal. She had the root canal done. She was one of the tooth pulled. Someone did a poor root canal. So I said, you know, Robert picked this up. I picked it up. We injected with Procaine. You seem to feel a little better. But, you know, when you're just injecting the area and it's infected, you're not really solving the whole problem.
You're just checking to see
if there's any improvement. Exactly.
Right.
So we went ahead and removed the tooth under protocol, which is not just taking it out, but it's taking it out with ozone injections before, removing the tooth, taking the ligament out, ozone injections during, taking the bad bone out, cleaning it out totally, ozone injections at the end, and suturing. We don't put any graft in this, just in case, because we don't want anything to disturb this field. I didn't see her for, I saw her for the post-operative evaluation. She said she's feeling better. Well, time went on. About a year later, she walks into the office. She had purchased a house. She's driving a car. She's talking to me. She's not hiding behind her daughter. And I said, wait a minute. You're Melanie's mom. She said, oh yeah, I am. I feel great. It was that tooth. This is the way I used to be before I had the root canal. It was just amazing. This amazing and she's been that way ever since.
Thank you.
It's
And
been a
I can
pleasure.
post this on YouTube?
Yes, you can. Yes,
I
you
hope
can.
we have some more interviews
Oh,
to
this is going to be
post, too.
interesting. There's some other things you should know. It's a very, very interesting profession. It's actually a pleasure talking with you, Robert.
Very good.
Thank you.
Thank you.